Hello, I'm Nick Hex, Associate Director at YHEC. I'm going to briefly explain to you how return on investment models can be used by health and social care decision makers. I'm going to talk about what return on investment is and its origins, provide some examples of how it's used, and discuss the advantages and weaknesses of the technique and some alternatives. One of the techniques that can be used to consider the affordability or budget impact of an intervention is return on investment analysis. The technique was developed from financial rather than economic analysis and consists of measuring the benefit of an investment against its cost. The cost of an investment will include the direct cost of the intervention, such as the cost of a new medical device or the provision of a course of physiotherapy, but it also needs to include any indirect costs that might apply. For example, there might need to be a clinic to assess the patient using the new device, which would incur an additional cost compared to standard care. Benefits can include improvements in health-related quality of life for patients or reductions in healthcare resource use, but they need to be monetised by attributing a value to quality-adjusted life years, or QALYs, or to an episode of healthcare. Having monetised costs and benefits, these can be modelled to demonstrate the net cash flow by subtracting estimated discounted costs from estimated discounted benefits. This provides a net discounted benefit estimate for a specific time period. Care needs to be taken with any benefits that include QALYs, as they are health values and should be considered separately from any measure specifically of net cash flow. Return on investment models allow decision makers to examine the net cash flow over time periods that may be longer than 1 year. If that is the case, then both the costs and the benefits need to be discounted to account for the fact that, in economic terms, costs and benefits are worth more to us now than they are in the future. The National Institute for Health and Care Excellence, NICE, applies a discount rate of 3.5% per annum to both costs and benefits that are projected into the future. The formula that NICE uses for return on investment is simple. The total or sum of discounted costs are subtracted from the total discounted benefits, and that product is divided by the total discounted costs. This is not a universally agreed formula though. Other organisations, such as Public Health England, use a formula which simply divides the total discounted benefits by the total discounted costs. To demonstrate this, we can consider this example. If an intervention has a 1-year life, so there's no discounting involved, with a total net cost of £15,000 over 1 year, and it yields total benefits of £20,000 over 1 year, then the total net benefit over that year is £5,000. Divided by the total net cost, this gives a return on investment ratio of 0.33. If the Public Health England formula was used, the ratio would be 1.33 because the benefits would not be shown net of the cost. This is often expressed as a percentage. In this case, the return on investment for this intervention is 33%. It can also be expressed as a ratio. For example, there is a £1.33 return for every £1 spent on the investment. NICE has a variety of return on investment tools on its website which look at a number of public health and well-being areas. These include tools to cover the costs and benefits of tobacco use reduction, improvements in physical activity, reduction in alcohol consumption, improvements in social and emotional well-being for adults and young people, and improvements in health and well-being for children, young people and pregnant women. NICE describes the key features of these tools as being the ability to model the effects of simple or multiple interventions on at-risk populations, allowing decision makers to consider overall costs compared to the value of non-health benefits, as well as health and well-being improvements, being able to identify cost savings or to decide whether additional benefits are worth extra costs, allowing users to customise the tools so they can use their own data rather than the baseline data included, and helping with the development of business cases. Here is an example of a results sheet from one of the NICE return on investment tools for smoking cessation. This shows the results of the introduction of a smoking cessation intervention in a CCG area in a number of different formats. The top line gives the net present value of cost savings, showing that the intervention incurs a net cost in the first 2 years, but is cost saving thereafter. The line below shows the net present value if expected health gains are monetised and included in the evaluation. This shows a positive return even after 2 years. Cost-benefit ratios are presented, along with the number of QALYs gained, and incremental cost effectiveness ratios, or ICERs. Where the results say that the current package is dominant, that means that the package has a lower cost but greater benefits than the baseline position. The advantages of tools such as the NICE smoking cessation ROI tool are that they are relatively simple to use and give decision makers information to allow them to demonstrate good stewardship of public funds. Data generated from these tools can be used in business cases as an evidence base for making a decision about investment in an intervention. The tools are validated and tested and are based on robust costing and accounting principles. They also help to raise the importance of financial and economic aspects of decision making amongst NHS and public sector staff. In terms of weaknesses of the approach, it's important to bear in mind that a return on investment that only examines financial metrics will not present the full picture in health economic terms. An analysis that only compares the costs of an investment with resulting reductions in healthcare costs will not be as robust as a cost utility analysis that takes into account the value of health gains as a result of the investment. This means that return on investment results can only be compared with a base case and cannot be used to consider the effects of displacing other cost-effective interventions if the investment is made. The basis of return on investment in accounting rather than economic conventions means that it may not be possible to use some economic analysis techniques. For example, more sophisticated sensitivity analysis may not be possible with more limited parameters in an ROI model. Importantly, sometimes ROI results can be hard to interpret. If an ROI ratio is looked at in isolation, it could potentially be misleading. This can be seen in this example. If we consider investment A first, this costs £10 and delivers 0.003 QALYs. If, as NICE suggests, we would be willing to pay £20,000 for one QALY, then we would be willing to pay £60 for 0.003 QALYs, giving a return on investment of 5 to 1. If investment B costs £200,000 but delivers 10.1 QALYs, then the value of the benefit generated is £202,000. That would only generate a return on investment of 0.01 to 1. However, if we look at the net health benefits generated, then it can be seen that investment A only delivers 0.0025 QALYs, equivalent to £50 value, while investment B delivers 0.1 QALYs, or equivalent of £2,000 of value. This is because of the relatively small scale impact of investment A, despite its seemingly high return on investment. In this instance, assuming that the options are mutually exclusive and non-repeatable, it would be preferable to recommend investment B, since it would have greater positive impact on population health. There are alternatives to return on investment analysis that can be considered. As has been discussed, cost-utility analysis presents a more complete economic picture compared with a financial return on investment, and it allows the user to consider the value gained relative to appropriate comparators rather than a single baseline. Perhaps the most compelling alternative to return on investment is the use of net health benefit analysis. This focuses on the value of population health gained minus that of health foregone, and so represents the most rational way of evaluating an investment in economic terms when operating within a fixed budget. So while return on investment is a useful tool for decision makers, it's also important to consider alternatives. If you would like to know any more information about this webinar or any of our other webinars, please use the contact details on the screen. Thank you for watching.